Hello students, we will discuss today a common sequelae after burn injury, which is quite common, often disfiguring. Just see what this condition is. See, look at here, across the knee joint. This is the area, concentrate in this area. So what is this condition is? So this is burn contracture across knee joint. See that? There is some called or some burn injury, old burn injury, which has caused a contracture like this. So that is the contracture. Contracture proceeds towards position of comfort on the flexor surface with the formation of hypertrophic scar. See that is very important. Position of comfort. So position of comfort occurs like this. In that, usually contraction occurs over the flexor surface. This is the position of comfort naturally. So what are the complications of burn contracture? All these things. Disfigurement, restriction of movements related to sight. Hypertrophic scar and keloid, there's a difference which we are going to discuss some other day. What are the differences between hypertrophic scar and keloid? Keloid is genetically related, it is dark, often it is vascular, it goes beyond the scar margin, unlike hypertrophic scar. It continues to develop, progress even after 6 months. So this is the difference. Pain, tenderness, repeated breakdown, cellulitis, ulceration, marjoline ulcer. This is a well-defined squamous cell carcinoma occurs in a long duration scar, which is not matured. So scar is repeatedly breaking down and eventually turns into squamous cell carcinoma, not sarcoma. So scar turns into squamous cell carcinoma, but it's not spread to the lymph node nor through the blood. So regional lymph node will not be there in the marjoline ulcer. So usually biopsy confirms the diagnosis as a squamous cell carcinoma, and wide local excision with the reconstruction is more than sufficient. That is marjoline ulcer, common cause is a burn scar. And so what is the treatment? All these things are the treatment: release of contracture, skin grafting, flaps of different types. Physiotherapy, rehab is very, very important. Pressure garments, reconstructive procedures, usually staged procedure. Release today, release further in the next stage, then eventually plan for the reconstruction, maybe one flap and another flap later, or skin grafting. So it is not a one procedure, everything will fix it. You have to do repeatedly 1, 2, 3, 4 surgeries to make disfigurement better and functionally better. So function also important, cosmetics is also important, reasonable correction of the disfigurement also important. Eventually, physiotherapy, rehabilitation, all these things are important in medicine. It's a very complex method, usually treated by plastic surgeon. That is burn contracture, very commonly asked a short note, Viva they will ask, and OSCE they may keep, MCQs will be asked. So remember what is burn contracture is. So read my clinical methods in surgery for examination. With the video examination is there all chapters, and detailed method properly mentioned very beautifully with illustrations and photos. And my manual is a very popular book covering CBME syllabus, everything with the footnote, with illustrations, photos, diagrams, text, case scenario, MCQs, everything is covered in my 7th edition book. And surgical operations 2-volume book. It covers small to biggest procedure, complex procedure in detail with photos and illustrations. Very, very useful for upcoming surgeons, postgraduates, and general surgeons or other surgeons who do different surgeries. Suturing technique atlas gives a beautiful illustrative video with the text briefly around 100 pages. So it explains how suturing is done properly, different types of sutures, and with a backup proper video also. And my Diginor lectures through JP Publishers covers everything, CBM syllabus, all chapters, including specialties, including clinical method, examination, operative surgery, test, operative surgery, instruments, X-ray, specimens, everything. So students request to subscribe for 1 year and make your final year studies very easier, and also to attain a proper knowledge about the surgery as such. So students, I hope you understood burns contracture very well. Thank you very much.